Hello, my name is Jasmine. I'll be your student nurse today. I just want you to make sure you remember my name because I may be asking you to recall that later. Are you experiencing any pain today? How are you feeling? How are you doing?
I'm feeling good. No pain.
Good. And how do you feel about your overall health? Like, do you think you're pretty healthy for the most part?
Yeah.
Okay. And how old are you?
I'm 19.
Okay. And your race or ethnic background?
White.
Okay. And obviously your gender's female. What's your height and weight?
I'm 5'4" and 130.
Okay, perfect. So I would say that you're a vigorous, healthy Caucasian female who is 19 years old and who weighs 130 pounds and has a height of 5'4". So that would mean that your BMI is at the 21 mark, so that's great. It's in the healthy range. So keep doing what you're doing. From what I can tell so far, your dress, grooming, and hygiene are all appropriate. You have a general cooperative demeanor. Your affect is animated, and your thought pattern is logical, relevant, and organized, and your speech is articulate. I would say that your level of consciousness is around a 5, which is really good, and I would say that you're alert. So now I'm going to assess your orientation. So can you give me your full name?
Juliana Rabina.
Perfect. And where are you right now?
I'm in Egan.
Okay. And can you tell me what day of the week it is?
It is Saturday.
Perfect. So I would say you're oriented times 3, which is great. And now I will assess your intellectual capacity. So who was the president before Joe Biden?
Donald Trump.
And can you tell me my name?
Jasmine.
Perfect. And now I'm going to assess your abstract thinking and judgment. So if you had to explain the parable, an apple a day keeps the doctor away, how would you try to describe that?
I think it means that if you eat healthy and take care of your body, you won't need to go to the doctors as much for health issues.
Perfect. And lastly, if it were snowing outside, how would you kind of prepare yourself to go outside?
I would wear a winter coat and boots and gloves.
Okay, perfect. So I'd say your intellectual capacity is all generally intact, so that's great. Okay, so now I'm going to assess your vital signs. I'm going to do your blood pressure first. Okay, it's going to be a little bit of a tight squeeze. So I got 114/72, which is really good. And now I'm going to assess your pulse and respiration. So just your arm. So for respirations, I got 16, and for pulse, I got 64, which is all within the normal range. I know that you said this earlier, but I just want to reinforce that you're not feeling any pain. Nope. Okay, perfect. And I don't have a thermometer with me right now, but if I did, I would press the button, place it in the middle of her forehead, go back towards behind the ear, then without lifting up the button, I'd place it behind her ear back here, and then I would read it, and you have 98. Which is great temperature. And I also don't have a pulse ox, but with that I would take the machine and clamp it on her finger, and then a good range would be anywhere between 95 and 100%. So I will be assessing your head and neck. From what I can tell, your head is the normal shape and symmetry, so I would say that you're normocephalic. Your hair seems to be evenly distributed amongst your head, and just based on some light tugging, I'd say it's firmly attached to the scalp. As far as your scalp is concerned, I see no lumps or feel no lumps or lesions, which is great. Your eyes seem to have proper alignment and you have the appropriate prominence. Now I'm going to check that your pupils are equally round and reactive to light. So I'm going to shine this light in your eyes 4 times, 2 on each side, and I'm just going to have you stare at the bridge of my nose. Okay. And now I'm going to have you look at the wall behind me, and then when I tell you to, just look at the top of my pen light. Okay, so, okay, you can look now. All right, perfect. I would say that convergence and constriction are both intact. Now I'm going to assess your EOMs, so I want you to look at the end of my pen light and move only your eyes and not your head. Okay, so I would say that your EOMs are intact. Cranial nerves 2 and 3 are intact with the pupils equally round and reactive to light, and your cranial nerves 3, 4, and 6 are intact as seen with your EOMs. So now I'm going to assess your ears. Based on inspection, I'd say they're pretty symmetrical. I don't feel or see any lumps or lesions, which is great. Your gross hearing seems intact. Do you have any issues with hearing, any hearing aids?
Nope.
Okay, perfect. So now I'm going to look into your ears and assess them for any redness, lesions, discharge, or drainage, or foreign bodies. So I'm going to pull your ear up, out, and back. All right. And then I'm going to come around this way. Pull your ear up, out, and back. All right, perfect. I didn't see any drainage or foreign bodies, redness, lesions, which is great. So now I'm going to assess your nose. I'm going to look for any drainage or congestion that may be present. Do you experience any difficulty breathing through your nose?
Nope.
All right, perfect. And do you have any difficulty with smells or anything?
Nope.
All right, perfect. So now I'm going to look through your nose. So if you can just tilt your head up for me. All right, perfect. Your nose looks great. Now I'm going to move on to your throat. So can you please open your mouth up nice and wide so that I can take a look inside? So your mouth looks pink and moist. Your teeth are all appropriate. I'm assuming you're not wearing dentures. All right, perfect. And now can I ask you to please flip your tongue up so I can look underneath your tongue. All right, looks great. All right, so your teeth look good. I don't see any apparent cavities. It doesn't seem like you have any missing teeth. Do you feel like any of your teeth are loose?
No.
All right, perfect. So for your mouth, I'd say it's pink, moist, and intact with no lesions. You're not missing any teeth, and there's no apparent odor that's coming out of your mouth. So now I've assessed your gag reflex. I don't have a tongue depressor, but what I would do is take the tongue depressor and I would push it into her mouth until the patient gags. Now I'm going to assess your tracheal alignment. So if you could just please swallow for me. Perfect. And just based on palpation, I can tell that your tracheal alignment is in the midline. So now I'm going to assess your lymph nodes, and I would like you to let me know if you feel any tenderness. auricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. They were all non-palpable. I didn't feel any lumps, which is great. Did you feel any tenderness?
No.
Perfect. So now I'm going to check your carotid pulse. So. Alright, this side. Alright, so on both sides, your carotid pulse was present and strong, so I would give that a 3+, which is great. And now I'm going to listen to your carotid arteries for any bruits. So I'd like you to take a deep breath in and out and then hold it when I tell you so that I can listen to your carotids. So take a deep breath in, please. And then hold. All right, and then you can breathe now, take a second, and then I'm gonna move on to the other side. All right, that's perfect. I didn't hear any turbulence, which is great. Your skin is all the appropriate flesh tone. You seem to have the appropriate moisture. Now I'm going to just assess your turgor. And your turgor is great. And your texture is smooth and there is no apparent lesions. Starting with your anterior thorax. Upon inspection, the size, shape, and symmetry all seem to be appropriate. Upon palpation, your shoulders are symmetrical and at the same level. Your clavicles appear to be symmetrical and at the same level as well. And your sternum is nice and vertical. So now I'm going to assess your respiratory excursion. So I'm just gonna have you take a deep breath in for me, and while I have my hands right there. So if you can turn your head to the side and take a deep breath in. All right. And your respiratory excursion was deep and symmetrical. So now I'm going to listen to your lung sounds on the anterior thorax. So I just want you to breathe through your mouth, no quicker than normal. Please turn your head for me. All right. Whenever you're ready. To assess your posterior thorax. So just based on inspection, I see no obvious lesions and you seem to have the appropriate flesh tone. There's no obvious deformity. Based on your inspection, I see your size, shape, and symmetry are all appropriate. Your shoulders seem to be at the appropriate level and your scapulae are all symmetrical, which is good. So now I'm going to assess your spine. So I'm going to start at the base of your neck and work all the way down. So let me know if you feel any tenderness upon this palpation. Did you feel any tenderness? No? All right, so that's perfect. Now I'm going to assess for your S curvature. So you seem to have the appropriate curvature, which is great. Now I'm going to assess your AP versus transverse diameter. So your AP diameter should be 1/2 of your transverse diameter, which it is, which means that that is appropriate and she's negative for any barrel chesting. Now I'm going to assess your respiratory excursion. So I'm going to place my hands like this, like I did on the front, anteriorly, and I just need to have you breathe in for me. All right, so your respiratory excursion was deep and symmetrical, which is great. Now I'm going to listen to your lung sounds. Again, I'm going to ask you to breathe deeply through your mouth, no quicker than normal, but I'm also going to have you give yourself a nice big hug just to displace those scapulae so I can hear your lung sounds. All right, so whenever you're ready. All right, so I would say that your lung sounds were clear, even, and easy, both posteriorly and anteriorly. The rate was consistent with what I saw with the vital signs. The rhythm was regular. The depth was deep only because I asked you to breathe deeply. However, when I wasn't asking her to do that, there was moderate inspiration, which is appropriate. Her breathing was non-labored, negative for the use of any accessories, and there were no adventitious breath sounds. I heard vesicular breath sounds, both anteriorly and posteriorly, bilaterally on both sides. So now I'm going to assess your heart. Just based on inspection, you are negative for pulsations, which is great. And now I'm going to assess for any pulsations or thrills. So find your second intercostal space. Negative for pulsations, negative for thrills. This is the aortic spot. Then hopping over to the pulmonic, negative for pulsations, negative for thrills. Then the third intercostal space, negative for pulsations, negative for thrills. Then the fourth intercostal space, negative for pulsations, negative for thrills. Then fifth intercostal space, tricuspid, negative for pulsations, negative for thrills. And then I'm gonna hop over to the fifth intercostal space midclavicular line, which is the PMI, which is positive for pulsations and negative for thrills. I would say that your PMI, the location was as it should be, and the rate was consistent with what I found in the vital signs. The rhythm was regular, the intensity was strong, the diameter is as it should be, the duration was appropriate as well. So now I'm going to listen through the auscultatory sites. So again, I'm just going to find the second intercostal space or aortic. Moving over to the pulmonic. Then third intercostal space or Erb's point. Fourth intercostal space. Fifth intercostal space or tricuspid. Then a half step for VSD. And then another little half step to fifth intercostal space, midclavicular line, or the mitral site. All right, so I would say Heart sounds all sounded appropriate. I got an appropriate relationship of S1 and S2 heart sounds. The rhythm was consistent with what I found in the vital signs. The strength was strong and there was no extra heart sounds. Now I'm just going to assess for JVD. We're not in a hospital setting, so we don't have a hospital bed, but patient is negative for JVD. So now I'm just going to assess your abdomen. Just based on inspection, it appears to be not non-distended. So now I'm going to auscultate in all 4 quadrants of your abdomen and specifically listening to these sounds in 1 quadrant for 1 minute. Now I'm going to assess your abdomen, and just based on inspection, I can tell that there's no distension, which is great. So now I'm going to auscultate your stomach or abdomen and listen to see how many vowel sounds I can hear within a minute. So I was able to hear around 20 vowel sounds within the minute, which is within the normal range of 5 to 34. So I would say you have normal active vowel sounds, but just to make sure, I'm going to listen to the 3 other quadrants. Great. I heard normal active vowel sounds all the way through, so that is great. Are you feeling any pain in your belly at all? No? All right, perfect. And now I'm going to percuss your abdomen, so just do this. So I heard the abdominal tympani all the way through, so which is great, which is what you're supposed to hear. So now I'm going to palpate your abdomen and let me know if there's any pain or tenderness. Did you feel any pain or tenderness?
No.
Perfect. So I did not identify any organomegaly, which is great, and I also felt no bladder distension. And based on, the physical appearance, I don't see any obvious lumps or lesions. Now I just need to ask you some questions about your bowel habits. Do you have any accidents when it comes to bowel movements?
No.
Right, perfect. And what is the color of your everyday bowel movement?
Brown.
Brown, okay. And do you know the regular consistency?
Like soft, but
Okay.
firm.
Soft but firm. Okay. Do you have like an idea of the usual amount?
Twice a day.
I was actually kind of asking more like
Like how much? I'd say a sufficient amount.
okay. Well, you already said that you go twice a day, which is great. That's the normal. When was your last bowel movement?
Today.
Okay, perfect. And now moving on. In the groin area, do you experience any tenderness?
No.
All right, perfect. And have you noticed any lumps or lesions? Perfect. Have you had any accidents with urine at all, ever?
No.
All right. And how would you describe the color of your urine?
Yellow, light yellow.
Okay. And how about the amount?
Sufficient.
Sufficient. And in terms of clarity, is it like clear or is it
Pretty clear.
cloudy? Now I'm just going to do a musculoskeletal assessment. So are you experiencing any joint pain?
No.
Okay, good. And as far as I've seen, I don't necessarily think that there's any deformity, which is good. And now I'm going to ask you a few questions about your range of motion. Do you experience any limitations in your joints or any stiffness?
No.
Okay. And how about any snack crackling or popping?
No.
All right, perfect. So now I'm just going to assess your extremities. So just let me see your arms. Just feeling your skin tone in your arms is appropriate. Flesh tone throughout. The temperature is warm. And then I'm going to assess your legs now, which the legs are also the appropriate warmth and the appropriate flesh tone. So now I'm just going to assess your pulses. So I'm gonna start with the radial. Okay, so both of your radial pulses are present, strong, symmetrical. So I would give that a 3+. Now I'm going to assess the posterior tibial. So I would say that those are also present, strong, 3+ and symmetrical. And now I'm going to assess the dorsalis pedis pulses. So just put. All right. And those were also present, strong, symmetrical, and 3+, which is great. Now I'm going to assess your cap refill, so I'll just press down like that and the color should come back within less than 2 seconds. So we'll just do thumbs, middle fingers, and your pinkies. And your cap refill in the hands were brisk. And normally we wouldn't have toenail polish on, but that's okay. I'll just do the cap refill. And I would say that the cap refill on her feet are also brisk. All right, and I haven't detected any edema, no puffiness or anything to the arms or legs. So there is no reason to check for pinning. To do a neurological assessment, so I'm just going to twist my fingers and can you squeeze onto them as hard as you can? All right, perfect. And then I would like you to grab onto my fingers again and pull towards yourself. All right, perfect. And then push towards me. All right, perfect. And then I'm going to have you do the same thing with your legs and your feet. So push towards me, push backwards. All right, and then go up and go down. I would give your upper and lower extremities a 5 for appropriate strength. So now I'm going to assess your coordination. So I'd like you to just hop off the bed and walk over to the podium and back. And Do you have the sensation of any numbness or tingling?
Nope.
Did you have decreased sensation anywhere?
Nope.
All right, perfect. So now I'm going to assess your deep tendon reflexes. Perfect. I would say that that's probably a 2+, maybe that's a 3+, high normal range. Now I'm going to do the triceps reflex, so just feel. All right. Perfect. Now on the other side. Perfect. All right, so I'd say that for the triceps reflexes, they're both 2+. And lastly, can you tell me my name?
Jasmine.
Perfect. It was a pleasure to work with you today, and this is the end of my assessment.